You guys excited to learn? All right, guys. I can't be more excited than you guys are. That would be really not so good. All right, how do I use this thing? Are they flipping through? Okay, cool. All right, guys, we're going to talk about the wonderful world of your microbiome, autoimmunity. We're going to dig in deep, guys, with the time that we have. And for those of you, how do we use this? How do we flip to the next slide? No one gave me one. Yeah. Oh, next slide. Okay, cool. Sweet. All right, guys. So next slide. Let's move on from that. Okay, for those of you who do not know what I do, I know I am, first of all, I am older than I look, okay, guys? So don't judge me for my boyish good looks. My doctorate is from Southern California University of Health Sciences in Los Angeles, and my postdoctorate education and training is in functional medicine, clinical nutrition. I'm on mindbodygreen.com. Does anyone know who MindBodyGreen is? But one of the largest, if not the largest, wellness websites in the world. I'm one of the course instructors and wellness experts where I get to teach around the world about functional medicine. And I have a clinic in Pittsburgh, Pennsylvania. About 80% of my patients are via webcam, Skype, FaceTime, that sort of stuff. We get patients care around the world. And I am the recent co-host with Jimmy Moore at Keto Talk. So for those of you who do not listen, you should listen. All right, guys, next slide. Next slide. All right, cool. This is MindBodyGreen's sort of team. That's myself, David Perlmutter, Terry Walls. There's like a few functional medicine people on here. All right, next slide. All right, first of all, let's frame this and go over the main differences between functional medicine and mainstream medicine. I think that's a good place to start for those of you who aren't so familiar with functional medicine. Number one, we interpret labs using a thinner reference range. You know the labs you have from your PCP or endocrinologist? We interpret those labs differently. We get those reference ranges that you get from your doctor from a statistical bell curve average of people who go to labs. Who are people that typically go to labs? Sick people. So there's a lot of people that go to their doctor that say, hey, I don't feel right, can you run these labs? And the doctor says they run the basic labs, and the labs come back quote unquote normal, even though you know instinctively, heck, I don't feel normal. You're told you're just depressed, there's an antidepressant, you just need to lose some weight, exercise more, or you're referred to another specialist with more labs. What they're unintentionally saying is you're a lot like the other sick people that make up the population of that lab. Because they're either not running the right labs, or they're not interpreting the labs they are running properly, or both. So in functional medicine, if you take people with health problems out of that reference range, what's left is a thinner range within that larger reference range of where your body's thriving. You are at optimal function. That's a much thinner range than the larger reference range. Next slide. We run more comprehensive labs that are typically not ran in mainstream medicine. This is a big topic. We're going to cover more about the microbiome and autoimmune aspect of this, but I could talk about it all day. The reason why these are not ran in mainstream medicine is not because your doctor is nefarious and wants to keep things from you. They're trained to diagnose the disease and match it with the medication. So if the end result doesn't change the medication, it's superfluous. It's extraneous. It's not needed. But from a functional medicine standpoint, we want to find out why you have the problem in the first place. Next slide. We take into account biological variability, which just means we're all created differently. There's not a cookie cutter, one size fits all to getting well. I see great healthy things work for some people. They don't work so well for the next person, and the next person, it flares them up. So we have to not have a bias as to, this is the way that everybody should do things, because you'll be proven wrong if you do that. So you have to look at their labs, you have to look at their health history, and then what actually works in their life and what doesn't work in their life. So as far as subjectively, their improvement of their life, but also improvement on their labs. Next slide. Yeah. That's the big, okay, cool. So I had it all the time. The secret was in my hand the whole time, guys. I don't have to say next slide anymore. All right, cool. So let's go beyond the label. The microbiome. Who's heard of the microbiome before? It's the trillions of bacteria. I'm a self-confessed gut nerd, guys, so bear with me. Humor me for a little bit. Your gut is home to trillions of bacteria. So upwards, and some studies show a little bit less, but upwards of 100 trillion bacteria. And you and me and all of us are about 10 trillion human cells. So you are, in fact, 10 times more bacteria than human. A sort of sophisticated host for the microbiome. So this is paramount to total health. This is a study that showed that the microbiome, and there are 9 million different genes compared to our paltry 25,000. The microbiome in our immune system. It is 80% of our immune system. Hippocrates, the father of modern medicine, he said, all disease begins in the gut. I don't know how he knew it, but that's why he's the father of modern medicine. That research is really catching up with antiquity. That about 90% of chronic health problems that we see today, at least to some degree, begin in the microbiome, if not entirely. And there's many studies show it's a factor in autoimmunity. Some researchers consider a precondition for autoimmunity dysfunction of the microbiome. You have what's called the gut-brain axis. When you were growing in your mom's womb, hopefully no one's still growing in their mother's womb here today, maybe some little babies, but your gut and brain are formed from the same fetal tissue, and they're inextricably linked for the rest of your life through what's called the gut-brain axis. 95% of your brain's happy, feel-good neurotransmitter, serotonin, is made in your gut, stored in your gut. It's referred in the medical literature as the second brain. I know I'm weird, but I think the intestines, if you think about it, kind of resemble the brain. Do you know what I'm talking about? I see it, at least. All right. So, the gut-brain connection here, microbiome is shown to impact myelin sheath formation. Its implication to neurological autoimmunity like MS. There's a whole field of research referred to as the cytokine model of cognitive function. Basically, how inflammation impacts how our brains work. So depression, anxiety, brain fog, ADHD, ADD, autism. These are all linked in the research to the gut-brain axis and this sort of pro-inflammatory cytokine activity of the nervous system. So we are all complex. We go to our doctor and we say, hey, I know something's not right here. You're given a medication. It's like, see you in 6 months. We need to dig deeper. Ultimately, none of us are sick from a medication deficiency. Would you agree with me? So let's find out the root cause of why we're going through what we're going through. So we're going to go on a journey, guys. We're going to go through the 4 gut problems that will wreck our health. Are you excited for this countdown? Are you excited for this countdown? All right. All right, guys, I'll wake you up. All right, number 1, SIBO. You've heard of SIBO before. You're well-read people here. It is an acronym, a funny-sounding acronym. I think the English call it SIBO. We say it right here in the States. But SIBO, it's small intestinal bacterial overgrowth. It's bacteria that's supposed to grow in our gut, but it's growing in the wrong location. It's too much. And anything in the body, as far as bacteria, yeast, hormones, inflammation, it's all subject to the Goldilocks principle. It's not necessarily good or bad, it's just balance, and balance is important. So SIBO is a lack of balance in the microbiome. You have what's called the MMC. This is not the Mickey Mouse Club, guys. This is the other MMC, migrating motor complex. It's sort of this wave-like motion of your gut to keep things, bacteria, into the large intestine and not proliferating, migrating into the small intestine. And you have a lack of that. What causes the decrease of MMC? A few things. NSAID use? Yeah. That never happened. Never happened. All right. So what causes the decrease of MMC? Medication use like NSAIDs, head traumas can cause a decrease of MMC. So what are some common SIBO gut symptoms? It's highly associated to constipation, diarrhea, IBS, irritable bowel syndrome, cramping, gas, nausea, acid reflux, heartburn, GERD. These are things that we see in the clinic a lot. Then there's far-reaching implications of SIBO. You don't necessarily have to have gut symptoms, or I would say severe gut symptoms, to have gut problems. There are many people that are pretty much asymptomatic in their gut. They're going to the bathroom pretty much okay. They wouldn't really think about it as being abnormal, but yet they're having latent underlying gut problems that will only be found out through labs. So SIBO is associated with type 2 diabetes, type 1 diabetes, many autoimmune problems like Hashimoto's, and then you have what's called the gut-brain skin axis, so acne, rosacea. These things are associated with SIBO as well. Number 2, microbiome imbalances. So again, subject to the Goldilocks principle here, we want balance, and we have to look at yeast function, levels of yeast in the gut, bacterial issues, and parasitic issues. These are pathogenic things that we don't want growing in high amounts. Number 3, we are looking at, again, balance of the microbiome. This is one lab that we run. We're looking at bacterial overgrowth here, parasite issues. This is not a third world developing country thing. This is something that we see a lot in people in the States. And guess what? This patient here didn't have any gut symptoms. She was going to the bathroom pretty much all right, but she had runaway anxiety. So we dealt with the second brain, and her first brain was fine over the course of a year. She's doing great. She doesn't have anxiety attacks anymore. She's not having mood swings. She's not depressed anymore. No more brain fog because we dealt with the second brain. So this is the far-reaching implications of the microbiome. Number 3, food reactivities. Our world has changed very dramatically in a very short period of time. So people are reacting because of these gut lining permeability issues to healthy foods. And we have to kind of look, if you cleaned up your diet, if you eat a ketogenic diet and you're still having food sensitivities, you still aren't where you want to be health-wise, what else has to be looked at? Well, because of these gut problems, your body can react to the seemingly most innocuous, nutrient-dense food. So we have to kind of take our biases and throw them out the window. So everybody's in agreement here. You heard of gluten, right? It's the G word in functional medicine and in the ketogenic world, for many different reasons, not just the carb standpoint, but this protein, gluten, can cause a whole wreck of problems. So wheat has been hybridized, everybody knows that here. So basically, if someone's on the fence with this whole ketogenic thing, maybe you're kind of dabbling into it this weekend, and you're like, well, I don't know if gluten's a problem for me. I want to keep it in as I love it so much, I just love eating bread. And you go to your doctor to find out, hey, is this actually right for me? And then the lab, they typically will run an alpha-gliadin test. Maybe they'll test you for celiac disease, and then that's about it. And then typically those labs come back negative, and you go and celebrate, say, hey, I'm not gluten sensitive, so you go get breadsticks at Olive Garden or something. It is an incomplete view of gluten sensitivity. So we have to kind of look beyond that. This is Cyrex Lab, one of the leading labs in their field, Arishta Vajdani's, one of the leading immunologists in this field, the Institute for Functional Medicine at the Cleveland Clinic, that's who's trained myself and my team, and these are the labs we go to. These are not quack labs, these are reputable labs that we want to kind of dig deep and find out what's going on here. So there's about a 25-piece gluten puzzle, and you can be negative to the alpha-gliadin, but be positive to other ones. Interestingly enough, trans-glutaminase 3 and 6, research shows that antibodies against this can elicit neurological symptoms like anxiety, depression, brain fog, and skin problems as well. And celiac disease, there's an overwhelming majority of people that go undiagnosed that have these neurological symptoms and are told, take this Xanax or take this medication, but it's neurological autoimmunity. This is cross-reactivity. If gluten sensitivity wasn't enough, these are for people who clean up their diet. These are even for people that eat a well-formulated ketogenic diet. These are foods that are innocuous, to say the least, right? But your body, because of gut lining problems, are reacting to these healthy-ish foods. What works for one person may not work for you. So dairy's on this list, chocolate's on this list. Who likes chocolate in here? It's a no judgment zone, guys. I will not tell anybody. All right, and then all these gluten-free grains, like all of them. Egg is on here, corn is on here, potatoes on here, rice is on here. So what does this mean if this lab comes back positive? Does it mean you're sensitive to eggs? No, it means you have a gluten sensitivity to eggs. It means your body thinks when you eat eggs, you're still having gluten. It's as if you had not gone gluten-free at all. So we have to look at the intricacies of the microbiome and intricacies of food sensitivity to really understand what's best for you. All right, number 4, leaky gut syndrome. You guys have heard of leaky gut syndrome, right? It's like an unfortunate name, like leaky gut syndrome? That's so gross. It's too early to talk about that. The reality is things are passing through the intestinal lining that shouldn't be passing through the intestinal lining. So you have these tight junctions. They're supposed to keep the gut nice and safe, but things are passing through, causing systemic inflammation. So what does the research show leaks through in this case? Lipopolysaccharides, or LPS, which are bacterial toxins that are in the gut to a certain degree in certain numbers, depending on the person, but passing through, the body's creating antibodies in the blood to LPS. This is linked to many different things, like cognitive problems, autoimmunity, inflammation at large, as well as far as undigested food proteins as well. All the foods we just talked about can pass through the gut lining, causing systemic inflammation. All right, so leaky gut syndrome is linked to just about everything out there, from arthritis to asthma, autism, autoimmune diseases. I mean, you can go on and on. Basically, any chronic inflammatory thing is at least associated in the research to leaky gut syndrome. Does that mean that everybody with these issues have leaky gut syndrome? Not necessarily, but it's such a common thing to at least rule out. And if you don't look there, you don't know if it's a factor for you or not. So I'm not giving all this information to put fear into you for the sake of it, but you have to know what you're up against to do something about it. This is really about health, responsibility, and due diligence for yourself. All right, so this is a blood lab that we run to look at antibodies against lipopolysaccharides and the proteins that govern gut lining permeability. So occludin and zonulin, think of occludin like a protein that occludes, and zonulin like a zipper. So you have antibodies against these guys, you have increased permeability, evidence of that, and you also, with LPS elevation, you have evidence that there's a breach of the gut lining integrity, causing inflammation throughout the body. All right, the autoimmune inflammation spectrum. There's over 100 different autoimmune diseases that we know today, and there's a 40 in addition to that at least have an autoimmune component. The criteria for diagnosis for autoimmunity are pretty end-stage problems. Like, by the time they get that bad, there's a lot of damage that has been done. So, for example, there has to be 90% destruction of your adrenal glands before you fit the criteria of being labeled with Addison's disease. There has to be about 80% destruction of the villi of your gut before it shows up on a biopsy, and it's bad enough where they'll say, oh, it's celiac disease. There has to be 70% destruction of your myelin sheath before it shows up in an imaging study and they'll say you have MS. Those things did not happen overnight. There are millions, 50 million Americans have stage 3 autoimmune disease. But there are millions more that are on this autoimmune inflammation spectrum. So there's 3 stages. There's silent autoimmunity, meaning if you ran labs, you'd probably see a positive ANA, see inklings of genetic problems, but no symptoms. And then stage 2 is autoimmune reactivity, where you're having problems, you don't feel well, but you have no answers for why you're going through what you're going through because you've not destroyed enough tissue to fit the official diagnosis of autoimmunity. What sense does it make to wait till your body's destroyed enough of itself to then do something about it? To then only be put on steroids or an immunosuppressant? There are millions more people in this stage 2 autoimmune reactivity that we see on an hourly basis, sadly, in our clinic. And these are the people that are sent from doctor to doctor. These are the people that have unexplained symptoms. These are the people that maybe have a positive ANA, and they're told things like, well, it looks like you'll get lupus in a few years. We'll come back to us then. That reactive sort of approach to healthcare is abysmally failing millions of people. We have to be proactive. What can you do today to take responsibility for your health? What can you do today to stave off the inflammation that is pervasive throughout your body? This is something that we need to be acting sooner rather than later. This is a study that looked at the component of dysbiosis or imbalance of the microbiome and its relationship to MS. Again, I could talk all day about just that study, but this is another study that looked at 20 MS patients, 40 controls, and found that people with autoimmunity had a loss of T regulatory cells, basically balancers of the immune system. So which one is going inside of you? And that's oversimplistic. The body's interconnected, so it could be a collection of number of those or none of those. So we have to dig deep and see what's relevant to the individual. This is poop, guys. We're just get real right here. You know who gave me this slide? Dr. Terry Walls gave me this slide. She said I could use it. And this is not her poop, though. She wanted me to tell you that. So, so you know the Bristol chart. This is like some action steps for you guys to know today. So where's your poop at? This is the first lab you should do in your life and see, okay, where are you adding up? So this is the Bristol stool chart. For those of you taking pictures, you can obviously Google this as well to get a better version of it. But this is looking at all the different types, and we want type 3 and type 4 as far as a sign of a healthy microbiome. You can feel more or less fine off of that on the extremes of those charts, but this is a clue to say, should I look deeper into my microbiome? Should I see what's going on there? So resistant starch, some exciting studies showing the effects on the microbiota, the microbiome, the balance of the microbiome, and controlling cancer, diabetes, and obesity. So you think, why am I talking about resistant starch at KetoCon? And I know this is probably slightly controversial, but what I see clinically and actually works in someone's life, it can be a tool for some people. Is it right for everybody? No. Is it good for some people? Absolutely. And we're talking about small doses here, like 1/4 of a teaspoon, maybe 1 tablespoon. So these are some good sources of resistant starches that can be great at feeding the good bacteria, which produce short-chain fatty acids, and they make a good, healthy microbiome. Okay. All right. Okay. It's not moving for me. The green button's not working now. Cool. So your body is interconnected here. You have what's called the gut-brain axis. We talked about that. But then you have the brain hormonal axis. You can start seeing the downstream impact that your gut can have, not only in the gut and brain and the immune system, where 80% of it resides, but the downstream implications it has on your hormones. You have what's called the hypothalamic pituitary adrenal axis, the hypothalamic pituitary thyroid, and gonadal axis. So a upstream or core gut problem can impact the downstream hormonal problem. So these are the things that we need to sort of look at the pathways here and how it's not only impacting the gut-brain axis, but your hormones as well. So what would you think of me if my check engine light came on in my car and I just covered it up with a sticker and kept on driving? What would you think of me? Normally I have somebody point to their spouse and say, they do that. I was in denial of a pending doom. Just because I keep driving doesn't mean it's gone. Your body is giving you a check engine light. The fatigue, the brain fog, the digestive issues, the unexplained inflammation despite doing healthy things, a check engine light. So what do? We go to the check engine light cover-upper station and say, take this sticker, see you in 6 months. Nobody is sick from a check engine light cover-upper deficiency. And our body is more intelligent than a car. So you go for another 10,000 miles, and that check engine light gets brighter. You need more check engine light cover-uppers. So you get more and more stickers. What's underneath the hood? These things that we looked at in the microbiome, because you take your car to the mechanic, he doesn't just cover up the check engine light and say, see you in 6 months. If your mechanic does that, get a new mechanic. We want to look at what's underneath the hood. And these are the factors of what's causing these symptoms that are oftentimes unexplained and settled for. So we look at comprehensive diagnostics, customized food medicine plan based on the individual, natural medicine, lifestyle coaching. Sticking again. Okay. Okay. All right. So these are some of the things that we take into consideration. Okay, we can move to the next slide. lovely green button's not working. So ketogenic and gut health, we know that having a healthy microbiome is essential for health. And ketosis, we know it works metabolically, but it works independently of metabolism on inflammatory cascades. So this is a tool that I use in just about every patient, depending on their goals, to drive inflammation levels down and help for a healthy gut. And then focusing on non-starchy green vegetables, good plant foods would help with feeding the good bacteria, and it's another source for resistant starch, our green leafy vegetables. Next slide. All right. So ketones also give the cell's ability to resist damage from autoimmune inflammation. This was a study that looked at MS, Alzheimer's, other autoimmune inflammation issues, and saw that there was improved cognitive function, improved memory, and brain sharpness, and diminished inflammation. So healing your gut and reducing inflammation reduces your risk of developing autoimmune conditions. Next slide. These are other advanced tools that we use, not for everybody, for some end-stage people that have tried everything. If you heard of poop transplant, guys? Fecal transplants, these are things that people that have tried everything but are still struggling with health problems that aren't getting better. We have to dig deeper, and we look at the studies here that find that fecal transplants showed favorable outcomes with people with autoimmune conditions, chronic fatigue syndrome. And then there's Helman therapy. Helman therapy are hookworms, roundworms, parasites that, again, people have tried everything. They take capsules with these hookworms in it to improve inflammation levels, because these guys are pretty savvy at turning off inflammatory cascades in the body to protect themselves. But in turn, it can be a tool for some people to dampen inflammation in their body. Is this for everybody? Heck no. But is it for people that with autoimmunity have tried everything and can't be on any more medications because it's not helping them? Yes, it can be. So, we see patients around the world via webcam and locally in Pittsburgh, Pennsylvania. So we offer tons of great stuff, free stuff online. We have a free health evaluation via Skype and phone at drwilcole.com, guys. Thanks for having me. I think we have some time for questions, like 3 minutes. Sorry for the technical difficulties, guys. So whoever has a question for me, probably have time for one. Yes. Yeah, that's not a bad approach. I would say with those foods being positive, they were the foods that you were eating a lot of. That's a sign of intestinal permeability. So my goal in functional medicine is not just go food chasing and removing foods that are showing up positive on a food sensitivity test, because it's really a sign of not the food's fault, but the intestinal lining problem fault. So if you went to the lab, hypothetically, I would say I've seen this a lot. If you go to the lab in a couple of weeks, you'd see different foods being positive. And then if you go a couple more weeks later, different foods being positive, because these are not highly immunoreactive antigenic foods. So you have to be radical with healing the gut. So is avoiding those foods that are high on that list a good idea? Yeah, it is a good idea. But you also have to be radically healing the gut. And I think that's where you said fermented foods and these other things are a good idea. Intermittent fasting can be another good idea. Bone broth fasting can be another good idea. So these are some strategies that we use. But yeah, more or less, those are some pieces of the puzzle that we implement for people that have those food sensitivities. Yeah, but you know what? The research for chronic health problems, that's I would say on the shorter end of what I would recommend. I've written about this before, but it can take up to 2 years to heal. So I know that seems like a long time, but what has taken years to get to where you're at now takes some time to heal. So sometimes people are reintroducing too soon. It's on an individual basis. I don't want to make any blanket statements, but we have people with severe food sensitivities and autoimmunity remove highly antigenic foods for over a year, 18 to 24 months, because to see the sustainable results they're looking for, that's what they're needing to do. If you feel great and your labs look fine, then that's another thing. But these are people that are really sick, and that's the way we have to get them better. Thank you. I think we're cut on time, guys. I'll be around here, so if you want to ask me more stuff.